I think guided surgery is not commonly taught in dental school. Sometimes it's part of the curriculum, sometimes it's sponsored by particular companies, and they start attending courses and they're trying to figure out how to get involved with guided surgery. Guided surgery requires
Everybody knows what AI is, right? And so there's developers out there that know how to develop websites and applications and do a lot of stuff like that. And one of the things that they've said about AI is you can take somebody who's like a level 1 or a level 2 developer and turn them into a level 8, 9, 10 developer. And you can do that really, really quickly because AI can help them close any knowledge gap and any speed gaps.
Definitely leveled out the playing field. And even for the single units, right? Single units, now I think we're looking at about 10 minutes per implant now. That's really fast. You go in, put on the guide, put in the implant, 10 minutes, you're out, patient's out. Now you're on to the next patient.
Welcome back to another episode. I'm your host, Gary Bird. I'm the founder of SMC National, where we help you create, convert, and close more full arch cases so you can grow the way that you want. And today I have Armand, who is the co-founder and director of S3 Smiles. And today he's going to share how you can level up when it comes to full arch. He shares how in the past, most doctors were only able to do one full arch case a day. And now we have people who are doing 3, 4, 5 arches every single day. And they have the ability to do that because of awesome technology. And he's going to share that with you. You're going to want to stay tuned. All right, we are live and I'm excited to have this conversation. And today I asked Armand to come back on and talk a little bit about how his product is helping GP offices that are adding full arch really level up. So can you walk us through what you guys are doing that's helping GP offices level up their full arch game?
Yeah, absolutely. So I'm going to kind of put us all in context a little bit of how we got here, right? Like, I think that's important to know. How do we get to this point now? I think it's important to remember about 10, 15 years ago, the realm of guided surgery for full arch cases was not as popular as it is today. So it was scary. It was, you don't know how long it's going to take. Perhaps complications may arise that general dentists are not prepared for or don't want to be prepared for, or maybe it's daunting for them to tackle. So what we're doing now is we're simplifying the process to where it's possible that a general dentist could perform a full arch all-on-5 surgery in an hour. Now, I'm not expecting everybody to be hitting a full arch at an hour mark. I think that's impossible for me to sell. But it is possible with our system now. And the reason why we're able to do that is because we simplified a process to where step 1, step 2, step 3 has become so much simpler than it has been in the past that now general dentists are able to tackle that, get in, get out quickly, and then be done with the case. So,
got it. And so what is for somebody who's never used guided before, or they've only like slightly researched, what are some things that they really need to understand about what you guys are doing? And explain it in a way for someone like me to understand, because I'm non-clinical. So I kind of have these like visions of robots and, all that kind of stuff. So like walk it through it in a very layman's term way that I can comprehend.
Absolutely. I think guided surgery is not commonly taught in dental school. So that's something to keep in mind for everybody. Sometimes it's part of the curriculum. Sometimes it's sponsored by a particular company. So there's kind of a mixed bag of where dentists come out of dental school and they start practicing and it's like, hey, what's guided surgery? And they start attending courses and they're trying to figure out how to get involved with guided surgery. They get into it. I get a case from a fresh new doctor getting into guided surgery, and they're usually the first thing is they're under-equipped. Like they don't know what guided kit to use. They don't know what data to send in. They don't know, any of those steps. So some of the things that are important to know. Guided surgery requires that you work with an implant system that features the guided surgery compatibility. This involves a particular guided surgery kit that you will need to use during surgery. So some examples of some companies out there, we love working with BioHorizons. We love working with Nobel. There's lots of other companies that are Straumann that have guided surgery kits that are ready to go, compatible with our system. So that's one aspect of it. You have to team up with an implant company that will have a featured guided surgery compatibility with us. That's very, very important. Number two is making sure that you get all the records and data necessary to get started. So that means CT scans, that means digital impressions or conventional impressions, although I will say that probably 70% of our cases come in as digital impressions. So we don't get conventional impressions anymore. And then send in the order and we'll take it from there and we'll walk you through all the way from start to finish.
Hey, Happy New Year. And thanks so much for listening to the podcast. I'm sorry to interrupt, but I got something really, really important to share with you that's going to bring massive impact to your practice. So every year, things change in your market. Every single year, people move, incomes change, populations change, and it's really important that you stay up to date with that. And one of the things that we offer to all of our customers, and we want to offer it to all of our listeners completely for free, is mapping out your new patients. So we're not going to only show you where your new patients are coming from on a map, just like this above, but we're also going to show you the income areas that they're coming from, the different pockets of income, as well as the populations to make sure that you have supporting areas to where you can attract more new patients. And lastly, we're going to map out all of your competition for you for free. This is 100% for free, no obligation. And we're really excited to share this with all of our listeners. So all you have to do is go to maps.smcnational.com and it's first come, first serve. We're not going to offer this forever. So if you want to get this, get in now, get all your new patients mapped out for the new year. We're looking forward to talking to you soon. Thanks. Awesome. And then what are some of the biggest holdups that you see that doctors have around this? Like from my point of view, it's like, why doesn't everybody do this, right? And you and I have talked before, not all doctors like approaching the problem this way. Could you kind of break that down, like the different camps of the people who don't like doing it this way, the people who don't know about it yet, and then maybe the people who love it and what they're raving about it?
Yeah, I would say that if you're comfortable with surgery without guides, hey, more power to you. There are very few doctors today that would confidently say, hey, I can hit the target without guides. Okay. And if you're one of those doctors, great. You don't need our services and you're probably doing a great job and you're really efficient. You're getting in and out, no problem. But then there are, I would say, another group of doctors who, and I hate to say it this way, but who think they're good at freehand surgery. And the reason why I say that is because you may be able to get it in the bone. So you look at a patient, you open them up, and you start doing drilling, and you put the implant, hey, it's in good bone. Okay, but is it restorable? Because the other part of it is not just the implant, but at the end of the day, the patient sees what? They see the teeth, right? They don't see the implant. They don't care where the implant is in the mouth. But is that tooth restorable to where you could actually put a crown or even a prosthesis, a full arch prosthesis on those implants? So that's the other important part. And I would say a lot of doctors, and there's actually several studies out there, you could be up to between 5 to 7 degrees off and up to 3 millimeters in all 3 dimensions off your target when you're doing a freehand surgery when compared to doing a guided surgery. There's several studies on that on cadavers. There's been several studies on that in models. I know Dr. Robert Stanley has done extensive studies as well with his students. And it's perfectly clear that when you're freehanding, you're not as accurate. No matter how great you think you are, the reality is, can you hit the target or not? So there's those groups of doctors that need it because, you may feel great about doing the surgery yourself, but at the end of the day, is it restorable? And then there's doctors that come out of dental school or they've been practicing for a while. You know what? They're honest and they're self-aware and they're saying, look, I'm not as good as I think I am. And my restoring dentists have been kind of complaining about restoring these cases. So I want to guide every single one of my cases. And I get those all the time.
Awesome. So if you were talking to the folks that are like in that in-between camp, what would be your words of advice and especially coming from your experience, like what you have seen and what you've experienced?
Sure. Yeah. I think we've done as a team of S3 technicians, we've done probably about 25,000 combined full arches together.
Wow.
That's not counting all the single units that we've done, thousands and thousands of those, even more as combined experience. And the reason why I bring that up is because, you know what, the benefit far outweighs the holdbacks. And what I mean by that is oftentimes the holdup is, hey, timing, more records, and perhaps cost, right? So maybe they have to wait a little bit for the surgery to be done. They can't do it same day. Obviously, if it's emergency, we can't make a guide that quick, right? So if it's emergency, somebody walks in, they need something right away, we can't do anything about that. That's on you. But if you can do guided, I would highly suggest that you go for it because the benefit far outweighs the holdbacks, the costs. The costs, we've made very, very competitive pricing for our products. So we're trying to help in that regard. At the end of the day, we're trying to make it also a standard of care, right? So by reducing our prices, we're trying to make it to be much more accessible for everybody, from single units to full arches. And then we're also trying to reduce the time too. So the time's getting better, the pricing's getting better, and you're only getting the benefits of accurate guided surgery at that point. So.
Awesome. Okay. So I want to ask you a question, and I want to kind of frame it the way I kind of think about it. So Everybody knows what AI is, right? And so there's developers out there that know how to develop websites and applications and do a lot of stuff like that. And one of the things that they've said about AI, and specifically like ChatGPT and tools like that, is you can take somebody who's like a level 1 or a level 2 developer and turn them into a level 8, 9, 10 developer, and you can do that really, really quickly because ChatGPT and AI can help them close any knowledge gap and any speed gaps, right? So all of a sudden you have endless access to unlimited code, and it makes you way faster. So now instead of you trying to figure it out on your own, the AI will help you develop it. And then it takes a level 10 developer and just makes them way faster, right? But it's kind of leveled the playing field from a speed and knowledge standpoint for developers in general. How, taking that concept of what you guys offer as a service and your product, how does this help dentists? Like somebody who's not as experienced, maybe they've only placed, a couple handfuls of arches. How does it help them level up? And then what about the dentists who are already really, really good? Like the top 1%, what does it do to them?
Well, let me put it in this way. My best customer that I mentioned earlier, he does a full arch in about 1 hour. Okay. I would get a text message from him. He'll say like 55. I'm like, 55 what? He's like, 55 minutes. That's how long it took me to finish one of your cases. That's unheard of with guided surgery. So put it in context. A typical freehand surgery with no guides, where they're putting in the implants manually with no guides, and they have to convert what we call a conversion, where we convert a prosthesis that's maybe a denture, and then seating it on those free-handed implants. That traditional time takes between 4 to 6 hours per arch. Okay, 4 to 6 hours for traditional non-guided. And then guided surgery came along about 15 years ago for full arches, and it took it down to about 3 to 4 hours. Now we're at 1 to 3 hours. Okay, so with our product, we're looking at between 1 to 3 hours for a full arch. So whereas before you could maybe do 1 arch a day, you're looking at a potential, unless, obviously mental breaks and all that kind of stuff you need to make sure you have.
You have to eat food.
Rests and breaks and all that kind of stuff you need to have. But potentially, it's not unusual to have two double arch patients a day. That's 4 arches in a day. Okay.
And probably you have people who even can do more than that if they're really.
That's right.
Yeah.
Yeah. So you're looking at potentially, if you have multiple operatories, you have multiple staff that's ready to go, you do the surgery and then they do part of it. You're looking at a possibility between 2 to 6 arches a day if you really want to. Whereas 1 was daunting for 1 day before, now you open up your timing to maybe doing 2, 4, maybe even 6 arches a day. Not an issue. So
awesome.
Yeah, the level definitely leveled out the playing field, and even for the single units, right? Single units, now I think we're looking at about 10 minutes per implant now. That's really fast. You go in, put on the guide, put in the implant, 10 minutes, you're out, patient's out. Now you're on to the next patient. So it's way quicker, way more. I mean, you have peace of mind. You're not worried about am I going to hit this anatomy? Am I going to hit that nerve? Am I going to not be able to restore this? What do I tell the patient that, hey, I got to redo this implant because I screwed up and angled it the wrong way? So you're cutting a lot of costs as well. You're not going back and forth. You're not having to fix things. Everything, again, the benefits outweigh the negatives at this point.
Awesome, man. So if someone wants to reach out and learn more about what you guys do, how does that look and feel? Like, how do I, like, if I'm a dentist, how do I actually figure out if this is something that I want to do?
Yeah. So with every new customers that we come across, we onboard them. We call them, we call these introductory meetings, basically to show you how we work. We're a small company, so we treat you like family, and we want to make sure that you're comfortable working with us. You know who we are, and then you go to our website s3smiles.com. Check out our products. We have events as well. We have educational courses that we partner up with around the country, and then we get started from there. So
awesome. What's the best way to reach out to you?
Yeah, so s3smiles.com is our website. Feel free to contact us from the website. Our Instagram is s3.smiles. It's very comprehensive in terms of showing case studies. So if you are more of a visual learner, there are lots of little snippets. It won't take much time for you to see what we do. And then, again, it has promos and it has events on there. So it has everything you need to get started with us.
Awesome. Thanks so much for coming on. Great job.
Yeah, thanks for having me. Thank you.
All right.